Good evening, everyone. It's a privilege to be with you tonight. Thank you for joining us for tonight's conversation with America's leading expert on infectious disease, Dr. Anthony Fauci. My name is Liz Thompson, and I serve as the Group Vice President of Development and External Search at Horizon Therapeutics. The impact of COVID-19 cannot be overstated. The effect this one disease has had across the entire world has underscored that science and scientific progress are more important than ever. At Horizon, we collaborate as one team of scientists, physicians, and development professionals to bring breakthrough medicines to those living with rare and rheumatic diseases. Whether you're a scientist working on a medicine for a small patient population, or one working on a medicine or vaccine to combat COVID-19, the scientific and healthcare community build partnerships that nurture innovation in order to benefit the global community. It's been tremendously inspiring to watch the dedication of healthcare professionals on the front lines and to see the collaboration between academia, industry, and dedicated public servants as we battle a common enemy. Tonight's speaker is one of those dedicated public servants. He served as the director of the National Institute of Allergy and Infectious Diseases since 1984 and has been a prominent leader in guiding the United States through COVID-19. He's also a personal hero to many, both within and beyond the healthcare communities. It's my distinct honor to welcome the man behind the medicine, Dr. Anthony Fauci. Please join me in also welcoming our moderator for the evening, co-anchor and correspondent for WTTW Chicago Tonight, Brandis Friedman. Brandis, I'll turn it over to you now.
Liz, thank you so much. And Dr. Fauci, it is a pleasure to meet you, albeit virtually. Thank you so much for joining us because you've been a little bit busy the last 7 months or so, I take it.
A little bit, yes.
Just a little. So the champagne cart's not coming by later on, so you can pick up your feed.
Not yet.
Not yet. That day will come, I hope. As our title suggests, of course, we wanted to learn more about the man behind the medicine, and we'll get to that. But of course, we have to talk about what's happening right now. So today, Illinois saw its second highest number of cases since the pandemic began. And the way Chicago's health commissioner is describing the rate of the increase right now, it seems that what some are considering the second surge is worse than the first, but basically among the worst that we've done since this began. Why is it getting worse? And why does this worsening seem worse than the first time, if that makes sense? And what can we expect?
Well, we certainly are not in a good position because when we had the original major surge that was dominated predominantly in the northeastern corridor with the New York metropolitan area, and then it came back down there, but then other cities like Chicago and New Orleans and Philadelphia and others, we never got back down to a baseline that was a low acceptable baseline. And then when we tried to so-called open up the country and open up the economy, we put forth a group of guidelines which were not consistently followed from state to state. And when that happened, we started to see surges generally that started off in the southern states, Florida, Texas, Georgia, Arizona, Southern California, to bring up the baseline, which was 20,000, which is extremely high, all the way up to about 70,000, came back down again to around 40,000 and got stuck there for at least several weeks to a month. Then the heartland, the middle part of the country, and the northwest of the country started to have an acceleration. And the baseline of daily cases came back up again to the point that last Friday, there were 83,000 cases in a single day. And if you look at the map now of the country, we're seeing more than 30 states, closer to 40 states that are showing upticks in the number of cases. There are a number of complicated reasons why that's the case. One, we never got down to a manageable baseline, so we have so much community spread that even the classic maneuvers like contact tracing don't work very well. And then when you look at what we're doing, the 5 or so what I consider staple type of common denominators, universal wearing of masks, distancing from a person 6 feet or more, avoiding crowds in congregate settings, doing things outdoors much more than indoors, and washing your hands frequently. If you look across the country, that has not been uniformly done. So now, as we're entering the cooler months in the middle of the fall and soon the cold months of the winter, we're in a very bad position when you think about where we're going, because the trajectory is going up. And then compound that with the holiday season coming, we have to do something different because we are clearly going in the wrong direction.
And I think that collision of times that you're referring to, the holidays approaching, the winter, as well as an increase in cases, I think it's scaring a lot of people. And a lot of people are starting to get, unfortunately, COVID fatigue. And then some people may not have been heeding all of the advice that you just referenced in the first place. How do you make the case to people that we have to hunker down and ride this out?
It's going to be a difficult message because you brought up a very important point. We've been going through this, literally since the end of January, the beginning of February, and then intensively as we went into the very early spring. There is COVID fatigue in this country, and it is understandable. So the message that we have to do is to say to the people of this nation that we understand the stress and the strain, but this will end. We will have a vaccine within a reasonable period of time. We will gradually be able to lessen a bit the constraints of the public health restrictions that we have. We don't want to lock down again. There is no appetite in this country for locking the country down again. But if we don't do that, and I hope we won't have to, then there are things that we can do to just hang in there, because it will get better. I know how it feels when people say, I've had enough of this, I don't want any more. But the alternative is to throw up your hands and make yourself even more vulnerable to the spread of the infection. So we all have to pull in there and encourage each other to stay with it and hang in there.
You mentioned the vaccine. You had said that by end of November, early December, we'll know whether we've got something effective. When that time comes, what will you be looking for? What do you need to see in a potential vaccine?
Well, what we have to see is what the independent bodies that are going to be monitoring this, they're referred to as data and safety monitoring boards, which are made up of clinicians, vaccinologists, statisticians, ethicists, look at the data periodically to determine A, is it safe? And if it isn't, should you stop the study? And B, when is the point arrived at where you can say it's effective and safe so that you can make an application to the FDA for approval? What I'm going to be looking at is the data, the raw data, to show whether or not it is or is not effective. I believe, and I'm cautiously optimistic, that it will be, that we will get a positive answer in at least one and maybe two or more of the vaccines, because there are 6 of them in play right now in the United States, 5 of which are an advanced clinical trial, which we call phase 3. 2 of them started phase 3 on July 27th, which is the reason why I can say that by the time we get to the end of November, the beginning or middle of December, we should know whether we have a safe and effective vaccine. And at that point, you can think about the distribution of doses towards the end of December, the beginning of January.
Now, we've heard a lot of back and forth between the White House and the CDC. The CDC sometimes making changes to their guidance and recommendations. Sometimes those changes appear to be at the direction of the White House or for political reasons. And we've seen a lot of public figures, a lot of politicians question our public health officials. Does all of this work to, unfortunately, erode our trust in our public health officials and our public health system?
Unfortunately, it does. I think we have to be truthful about that. When you see mixed messages and what are apparent, though they are most of the time not real, but apparent conflicts at the highest level, then it does erode confidence in the process. But the process is solid. It really is. I want to assure the American public that when you're looking at a determination as to whether or not interventions, be they vaccines or therapeutics, whether they really are safe and they really are effective. And it's not being motivated by political interest, I can tell you for sure that the process is solid. Even though you're quite correct, what you sometimes hear coming from Washington makes it look like there is influence that's not purely scientific. But when you're talking about vaccines and therapeutics, it will be based purely on scientific and public health interests.
Now, we have to talk about the president, of course, who has unfortunately referred to you on occasion as an idiot. That's a quote, or as a disaster, another quote. You seem like a pretty thick-skinned person, based on what I've read and researched. But does your relationship with the president ever weigh on you?
Honestly, not. I know some people can hear what you just said and shrug their shoulders and say, how could that possibly be? But I have now, for the last 36 years, been the director of this institute and have dealt very closely with 6 separate presidents. And when I get involved, as I do frequently, in the country's response to emerging infections, I focus like a laser beam on what I have to do, what my responsibility is to safeguard the health, the safety, and the welfare of the American public, and indirectly for the world, because we are a leader in global health. So those other things that you mentioned, the name calling and that, to me, that's just noise. It really is. I don't bother with that. It doesn't bother me. It doesn't influence me. As difficult as that may be for you to realize that, it's the truth. I don't waste a lot of time worrying about that.
I believe you, which is good to know. A lot of the country believes you. Right. When Dr. Fauci says something. So last week, the president signed an executive order reclassifying some federal workers into what is now called Schedule F. Could this mean that the president could have authority to fire someone like you?
Well, yes, it looks that way. And I think that's the reason why there's a lot of pushback and disappointment at various levels of that. Because, one of the things about our civil service is that it has been separate from and immune to political interference. And there is always a risk that if you have something like that, that there could be a lot of political issues that can be interjected into the process, which would be unfortunate.
You have also begun to receive armed security detail because you and your family have unfortunately received death threats. How does that affect you and especially your family?
Well, as far as I'm concerned, it doesn't affect me because I've chosen this life and I've chosen what I do. The threats are ridiculous. But they're real. They're not just phony. They're real threats on my life and my safety. I really mean that doesn't bother me at all. But what really bothers me is the harassment of my family. My wife and my 3 children, my 3 daughters, who are adult women, professional women. They're actually being harassed, by phone, by text, by letter. If you just drop back a few yards and figure out what that means, how preposterous that is, that because I'm delivering a public health message, there is such divisiveness in our society that there has been divisions based on your interpretation of a public health issue. There should be no division. Public health means the safety of the people in this country. And you have the kind of polarization that I'm sure you're very well aware of. Wearing a mask has become almost a public statement, which is ridiculous. Wearing a mask is a public health measure. So yes, it's happening. It doesn't bother me personally, but it does bother me that my family's being harassed.
There's a fight in Chicago right now, not a fight, but a lot of back and forth in Chicago over restaurants, specifically around indoor dining. And already the pandemic has been a death knell for many restaurants as winter, because you know what Chicago winters, you probably are familiar with what Chicago winters can be like. It could worsen for many restaurants. What are your thoughts? Are you eating in restaurants? Can they open safely?
Well, I live in Washington, D.C. We're in a pretty good place with regard to restaurants. Throughout the worst of this, even when we were locked down, I am very empathetic to the plight of the restaurant owners. So what I have done frequently, multiple times a week, is instead of sitting in a restaurant, I go up and I take out, even though it's very easy for my wife and I to cook indoors, we almost always order out because we want the restaurants, at least in the neighborhood where we live, to at least have some viability. And I believe that many people in the neighborhood that I live in, Washington, D.C., are doing the same thing, is to try and help out the restaurants so that they don't close because of this really important and difficult challenge of COVID-19.
Now, when I was researching for this interview, I found a lot of material to go on, because obviously you do a lot of interviews and you've made yourself available frequently to people like me. Why is it important for you, despite, I think maybe you've had some occasional restrictions from the White House, but why is it important for you to be available to take questions from people like me?
Well, I think transparency and communication is critical, absolutely critical, to getting the country safely and effectively through challenges such as a pandemic of the magnitude that we're living through now. And as a scientist and someone who's driven by data and evidence, I think it's important for me to make myself available to people like yourselves who actually will be able to spread information that will be important if we're going to cope with this properly. So I do this as often as I possibly can, because I think it's as important as the other things I do, which are developing the vaccines that we ultimately will be using, as well as the therapies. That really is my day job, as it were. But I think the things I'm doing now with you and with others like you is equally as important.
So during previous epidemics and some pandemics, Ebola, bird flu, swine flu, you've always made it a priority to also treat patients in addition to, the work that you have to do in your office. Why is it important for you to actually be at a bedside?
Well, my identity is primarily as a physician. I mean, I have multiple hats now. I run a laboratory. I'm a scientist. I run a very large institute, the National Institute of Allergy and Infectious Disease. I get involved in a lot of policy issues, like developing the PEPFAR program or being one of the architects of the PEPFAR program, which is the President's Emergency Plan for AIDS Relief. But deep down, when you ask me what I am and who I am, I'm a physician. And so I continue to see patients and treat patients, even patients with diseases like Ebola and COVID-19. And I do that because I believe if I maintain my identity as a physician, I will have a much better perspective of the needs of what research needs to be done in the areas that I'm involved with. So I do it willingly and enthusiastically because it's part of my identity.
I read or heard that you once said somewhere that you have to make a dramatic change to get a patient to turn around if someone isn't doing very well, and that's kind of where the action is. What do you think? What do you think our dramatic change is if we're all the patient right now?
No, what I was saying is that part of my personality is that I like really serious challenges. That was one of the reasons why I went into infectious diseases. Infectious diseases, historically and globally, are things that are acute. They either kill you or you get better, usually by someone treating you with an antibiotic or an antiviral or preventing infection with a vaccine. So I liked the dynamics of infectious disease. And that, there are many other wonderful subspecialties of medicine that I have a great deal of respect for. But for me, the interplay between a pathogen that's trying to do the human species in and the immune system of the human species trying to protect you against this pathogen, to me is just very, very exciting. And I have been excited about that since I did my fellowship training many, many years ago.
So here in Chicago, public schools are currently on remote learning. The district is hoping to return some students to in-person. There has been a lot of disagreement about that with the Chicago Teachers Union, that there are some districts in the area that have been able to reopen. Under what circumstances do you think schools should return to in-person learning? And also, what of the mental and social impact that the learning, that not being in school has on kids, and the learning loss, the deepening inequity?
Yeah, I think what you just said just a moment ago is absolutely critical to what we need to do. And that's the reason why I say our default position should always be to try as best as you possibly can to get children back in school, because of the unintended negative spin-off consequences of what happens to children and families when you keep them out of school, for their mental health, their physical health, their learning, as well as the disruption of the family. Having said that, when you're dealing with a situation where you have a great deal of variability in the amount of infection in a particular community, you have to fashion your decision and what you do to mitigate against that based on how bad infections are in your community. For example, we now rate the country as dark green, which is really safe, green, safe, yellow, orange, and red. If you have relatively little infection in the community, you can get the kids back to school with very little modification. When you start to get into the yellow and the orange zone, we have enough infection to be concerned about, you need to have a plan of how you're going to get the children back to school safely. That could be hybrid models of part virtual, part in person. It could be alternating days or alternating morning and afternoon. Obviously, teachers and children who are older than 2 years old should be wearing a mask. Those are the kind of things that you can do. However, there may come a time or a place or a location where there's so much infection in the community that you might want to just hold off getting the children back and doing it mostly by virtual. But as I want to repeat again, the default position should always be to try as best as you can to get those children back to school.
Obviously, you've been in your position for quite some time, since you were a wee person. But why weren't we ready for this? Obviously, we know that the president, it depends on who you ask, whether he disbanded the Pandemic Response Unit, the National Security Council Directorate for Global Health, Security, and Biodefense, or if he streamlined it. But either way, it does not exist in the same, fashion that it once did. Why weren't we ready for this?
There is no simple answer to that. It's really very, very complicated. It's interesting. Most people don't appreciate that several years ago, when we were confronted with the possibility of a potential pandemic with the bird flu, you might remember the H5N1 and the H7N9, that was jumping species. It didn't spread well at all from person to person, but when a person was infected, the mortality was really quite high. We put together a pandemic preparedness plan. And interestingly, it was judged prior to COVID-19 by organizations like the Johns Hopkins University as being the best prepared country in the world for an outbreak. And you saw what happened. So the kind of classic preparations that we make obviously did not work for a number of complicated reasons. There was the original misstep in the beginning with the testing, that we didn't have adequate testing. We improved that. And then there was a situation where the United States of America, the beauty of 50 separate states and the federalist approach that there needs to be a considerable degree of independence on the part of the states. Well, for some issues, that works really well because we have a lot of differences from state to state. But when you're dealing with a pandemic that is affecting the entire country, you really need to react and respond as a nation, not differences that are really very, very significant from state to state. We saw that when we tried to reopen the country or reopen the economy, when we put forth a guideline group of a particular benchmarks, a gateway, phase 1, phase 2, phase 3. And when we put that out, we made recommendations of what you needed to do to safely and prudently open up your state, your city, your county. The problem is that wasn't done uniformly. Some states didn't really actually disregarded it and jumped over these benchmarks and went to wherever they wanted to go. Other states actually tried hard to do it right. But the people in the state didn't listen. They didn't want to be told what to do. So you see pictures and clips of people congregating in bars with no masks and having these super spreader type events. That's what happened. So it isn't one single thing that led to the difficult position we're in right now. It's a combination of multiple factors that unfortunately just conflated together to put us in the position that we're in right now.
Dr. Fauci, I joke with my friends that the pandemic changes people. I cook more now than I used to, and it's not that I have more time, because I don't. I started running. I hate running. I know that you are a runner, but I had to get out of the house and I had to exercise. So that's all that was available. It's not like I could go to a gym. So maybe it's changed some people for better or worse. How has this pandemic changed you?
Well, it has a profound effect on my life because I have not had a day off since January. And I mean that seriously. I have not had a day off since January. And it is, I've worked hard all my life, but the hours that has put this in, it has been one constant challenge after the other. And it's very serious business. So it has really turned around my life completely. I do like you. I mean, I have always been a runner. So the one release I get from the tension and the stress is that I try to get out most every day. Interesting. I usually do it in the evening. So here I am speaking with you, which is fine.
Oh, I'm sorry. We're keeping you from the run. I feel bad.
Otherwise, I would be out. But there are other things. I think you point out things that you don't really pay attention to. But like you, I used to love with my wife. My wife works at NIH with me. And we often stay late at work. And when we come back from work, we don't want to cook. So we go to a bar, sit down, have a beer and a hamburger or something, and just relax and unwind in the neighborhood. The people know us. So I haven't done that in like 8 or 9 months. I haven't done that at all. So it's things that you don't do that you really miss. And then things that you say, like running, which is really good for you, that you would not have done if we weren't in this position. But the issue that I do point out once, I really literally have not had a day off since January.
Hopefully you'll get that day off. And this will be my last question. I want to bring in Brad Keywell in just a bit. But what does the end of this pandemic look like, whenever that is? In 2021, 22, what do we all need to see, and what will our lives be like?
It's going to be a gradual return to normal that's going to be facilitated out of the necessity of a vaccine. So we will get a vaccine, as I mentioned, that will start to be deployed likely in the beginning of 2021. People are not going to all get vaccinated at once. And depending upon how effective the vaccine is and what proportion of the population decide they want to get vaccinated, that will then, over a period of several months, probably as we get into the third or fourth quarter of 2021, there will be a gradual relaxing of the public health restrictions. Let me tell you what I mean. I think we'll have to be wearing masks for a considerable period of time when you're outdoors. But there are going to be things, for example, like restaurants, indoor eating will open up much more, as we know that we're protected by a combination of the vaccine and public health measures. Sporting events will likely have spectators where they don't have them right now. Theaters will be opening, maybe not full capacity, but people will be able to feel comfortable about going to a movie theater or to a concert of some sort. That's going to gradually evolve. And I think it's going to take at least a year to get back close enough to what you and I knew was normal before December of 2019.
Okay. Dr. Fauci, again, it's been an honor and a privilege. I just want to say that while I have the opportunity. Thank you for taking the time. I hope that when this is over, you get a day off sooner than in a year.
Yeah, and I'll go out for a run with you then.
You'll definitely leave me in the dust. I want to bring back in the founder of Chicago Ideas, Brad Keywell. Hey, Brad.
Hello. Let me, first of all, thank you, Brandis, for doing the interview and for WTTW's support, and also Horizon for their support. Dr. Fauci, it's really an honor to have you on behalf of the entire Chicago Ideas community. I've got 2 or 3 more questions, and we'll let you hopefully go for a run. Let me just first offer the hope that it gives me personally that someone of your intellect and someone who is looking out for the interests of every human being, every citizen of our country, that someone like you is in the position that you are. So with that hopeful sort of thought and reflection that I think you are one of the most trusted people in our country, I ask how you reconcile something that's part of your profession, which is the Hippocratic Oath, which has been for 2,500 years an oath that doctors have taken as they begin their career. And the core is to do no harm and also to look out for the patient first and foremost. How do you think about your patient in your current role? Is it the country? Is it who is the patient? And then how do you correlate or reconcile that with the chain of command, which might conflict with the Hippocratic Oath and the duty that doctors have?
Yeah, well, that's a very an excellent and an insightful question. It's both. I look at the country as a whole. As I mentioned just a little bit ago, I consider my primary identity as a physician. So the Hippocratic Oath means a lot to me because my identity is as a physician. I look at the country as the aggregate patient that I feel responsible for. Do no harm and make the welfare of the patient the primary motivating force of everything you do. That is embedded in the Hippocratic Oath. So when I'm doing what I'm doing now, it's actually the patient is the country. Just today, this morning, I made rounds on individual patients with COVID. And you use the same principle with them as you do with the country. One, do no harm. And these patients that we are taking care of are on investigational protocols for experimental drugs. So you want to give them the benefit of the possibility that the drug would work, but first and foremost, you do no harm. And then second, make the welfare of that patient the primary motivating force of what you do. So it was a very insightful question. There's the aggregate patient and there's the individual patient. The chain of command has absolutely nothing to do with what I do, really. I mean, what goes on at the White House, at the Congress, or whatever, when you are a physician and you have responsibility for a patient, that overshadows everything. There's no one that can interfere with that bond that you have, whether the patient is the country or the patient is an individual.
Can you recall a situation, even in history, where the Hippocratic Oath and the chain of command might not correlate?
Oh, I think one of the most egregious examples of that was in Nazi Germany, where physicians were experimenting on individuals at the order of the Nazi hierarchy. I mean, that was a terrible and egregious relinquishing of the Hippocratic Oath that I'm sure every one of those German physicians took when they graduated from medical school.
And sticking with that same theme, for the young people that are watching this and who now universally, I believe, know the name Dr. Fauci as someone who is the foundational voice of what's happening these days, what do you say to young people who are thinking about going into medicine?
Yeah, I tell them, I encourage them to follow that dream if they're thinking of doing it. There are many professions that are wonderfully satisfying for different people. But if you have the slightest inkling of going into medicine, I can tell you it is an extraordinarily gratifying profession because it combines science in the biological sciences, which continually learns more and more week after week, month after month, year after year, so that the capabilities that you have as a physician today are much, much better than what it was literally 10, 15, 20 years ago, things that we can do now. And the idea that you are doing something and focusing all of your energy on the health of another individual, sometimes in a life-saving way, because many of the diseases like COVID-19 that we're involved with are actually life-threatening. So if you can do something to save the life or preserve the health of another human being, for me, there cannot be anything more gratifying than that. So I encourage people who are interested in doing that, follow the dream. You won't be disappointed.
You turn around and pick up one book behind you that all of us who are watching and who watch this at some point should read.
Well, let's see. Well, there's a book by somebody who was one of my heroes, who is C. Everett Koop, who was the Surgeon General during the George H.W. Bush administration, who was a pioneering Surgeon General, who was appointed. Actually, he was the Surgeon General during the Reagan administration. He was appointed because they felt he was a very conservative person to go through the conservative agenda. And when he was confronted with HIV/AIDS, he became a champion for things that the people who were really reluctant to get involved in doing anything about HIV/AIDS. So he's one of the real heroes. So there's an autobiography of him. I recommend people reading that.
One of my favorite books is Profiles in Courage, and it speaks to heroism in the American story, which really, to me, is about people speaking up when it's hard to speak up, but when it's the right thing to do. Speaking up no matter what, when they know what they believe is right, and speaking up despite potential political consequence or otherwise. So in that spirit, I believe that I'm speaking right now to a true hero who will go down for generations as an example of goodness, not just greatness, but human goodness.
Very much. Thank you. That's very nice of you. Thank you.
I thank you for your service, and I thank you for joining us on the Chicago Ideas platform.